Hi, my name is Kearney. I'm the Northeast Ohio Hub Director with the Mental Health and Addiction Advocacy Coalition. We are a statewide membership-based coalition that works on public policy advocacy related to mental illness and substance use disorders. We have a variety of membership organizations such as the Women's Recovery Center that represent stakeholders in the behavioral health field, and we advocate on behalf of them and their clients. Since I began in my role about 4 years ago, the work has become more personal to me as well. I experienced postpartum anxiety and depression after my son was born, and it's made this work feel a bit more personal and helped me realize the real importance of advocacy and access to services for everyone. Co-occurring disorders means that a person has a substance use disorder and a mental illness occurring at the same time. And it's very common, so about 50% of people are believed to have a co-occurring disorder. And access to services is really important for people to be able to get treatment for both of those disorders simultaneously. From a workforce perspective, it's especially important that people trained in treating substance use disorders can screen for and assess for mental illness and vice versa. We see a lot of people that struggle to maintain a job or lose touch with part of their personal support network because they're not able to maintain those relationships in addition to all the stresses that they're facing. 1 in 5 people in the US are believed to have a mental illness at some point in their life. So just having resources available for all of those people is really important. And bringing visibility and awareness around how common they are to kind of normalize the experience for people that might be afraid to seek treatment. Some insurance plans have high deductibles, which makes accessing services really hard. So having the availability of community providers is really important for the underinsured or uninsured populations to make access equitable for everybody. Being open-minded about what it means to live with a mental illness or substance use disorder is really important. Understanding that treatment does help and helping people access treatment is also really important. I think one thing a lot of members of the community don't always know or have a high level of awareness of is what different symptoms of a mental illness or substance use disorder can look like. So for example, a lot of people think when somebody lives with depression, they're sad all the time or crying all the time, and some symptoms can be anger or irritability as well. So somebody might not recognize those symptoms in themselves or in a loved one, and having a better baseline understanding of what those things might mean can help people access services.